Hi, this is Dr. Wall. This is a summary and review of the 5-star study guide for your written board preparation. Fetal circulation. There are three main shunts: ductus venosus, foramen ovale, and ductus arteriosus. 50% of the blood is shunted through the liver via ductus venosus. The majority of the blood is shunted across the heart from the right atrium to the left atrium via foramen ovale. And the blood that does go into the right ventricle, that's pumped into the right pulmonary tree, traverses between the pulmonary artery and the aorta, and this is called the ductus arteriosus. So if we follow blood from the placenta through the umbilical vein, 50% shunted through the liver via ductus venosus, inferior vena cava, then we're in the right atrium, and from the right atrium, we go into the left atrium. The majority of the blood goes into left. You notice a big arrow here, a little arrow here. Then you see a lot of the oxygenated blood is then in the left ventricle and gets sent out through the aorta right here and into the circulation. And the arrow becomes darker as the oxygen is consumed, on back to the placenta with dark arrows, and then to be reoxygenated and then come back with the light arrows again with a higher O2. O2, when it's high, the PCO2 is low. And when the PCO2 is high, the O2 is low. Now you've got these chambers. Where do you think the highest oxygen in the fetal heart would be? It's going to be in the right atrium. Where is the lowest? A lot of people would guess that it would be the chamber of the heart that is furthest from the placenta, which would be the left ventricle, but that's not the case. The blood is more deoxygenated in the right ventricle because most of the deoxygenated blood from the superior vena cava goes down into the right ventricle, and a very small amount of oxygenated blood goes into the right ventricle. The majority of the oxygenated blood goes across the foramen ovale. Now, let's look at another drawing of the heart. And this has your umbilical cord, and here's the fetal liver, ductus venosus. Then when we get the blood into the heart, into the right atrium, notice that has the highest PO2, and the right atrium has the lowest PCO2. The blood goes through foramen ovale. Some of the blood goes down into the right ventricle. You notice that the oxygenated blood that goes from the right atrium to the left atrium and down into the left ventricle, then to be pumped to the aorta with these pink arrows to furnish the rest of the body with oxygen for growth and nutrition. You notice that what's highest with the PO2 is going to be the right atrium. The lowest PO2 is going to be in the right ventricle. The opposite is true for the PCO2. The PCO2 is highest in the right ventricle, and the PCO2 is lowest in the right atrium, which has the highest oxygen. It's a neat drawing that demonstrates this. And here are both drawings side by side, so you can compare these. Now, which chamber of the ventricles, right and left, have the highest oxygen? It is going to be the left ventricle, has a higher PO2. Now, I'm a firm believer in learning one set of information and then extrapolating other sets of information. For example, if we've got let's say we have tetralogy of flow. With tetralogy of flow, what is one of the abnormalities? It is going to be overriding aorta. If you have a problem with an overriding aorta, then you're going to get pulmonary stenosis. And when you have pulmonary stenosis, then you're going to get right ventricular hypertrophy. And then with right ventricular hypertrophy, the septum won't form here, and then you have a ventricular septal defect. So if you learn one situation, you can extrapolate the others. Overriding aorta, okay, overriding aorta. Then you're going to have pulmonary stenosis. If there's an overriding aorta, you'll have pulmonary stenosis, right ventricular hypertrophy, because with the pulmonary stenosis, the right heart has to work harder. And then with the right ventricular hypertrophy, the septum, there isn't enough tissue there for the septum to form, and they develop a ventricular septal defect.